Hello, my name is Francis Felicitas, and today I'll be presenting my Rogerian argument on the nursing shortage crisis. My goal is to explain both sides of the debate, show what research tells us, and present balanced solutions that can genuinely strengthen the nursing workforce. The United States is facing a major nursing shortage, and hospitals and clinics simply don't have enough nurses to meet growing patient needs. This issue matters because it threatens patient safety, increases burnout among healthcare workers, and affects the quality and accessibility of care across entire communities. My stance is that the nursing shortage is a serious and dangerous crisis that demands urgent solutions, especially improving working conditions, expanding nursing education, and creating long-term workforce strategies. But the opposing position argues that shortages may be overstated and that big staffing increases are financially unrealistic, especially for hospitals that already struggle with tight budgets. Understanding both sides helps us build a middle ground. Um, One of the clearest signs of this crisis is the overwhelming pressure placed on nurses. Many face burnout, unsafe patient ratios, and workloads so heavy that it pushes them out of the professions. These conditions harm nurse well being, but they also directly affect patient safety and care quality inside hospitals and long term care facilities. Opponents argue that increasing staffing sounds good in theory, but it isn't financially realistic for many hospitals. Rural facilities, for example, operate with very low revenue margins. Haddad and colleagues explain that the cost of recruitment, onboarding, and retention are already extremely high in overstretched systems. COVID 19 also raised operational expenses, leaving hospitals with little flexibility to hire more nurses. Um, Another opposing point is that although increased staffing improves patient outcomes, it may not always be cost effective. Griffiths et al. Found that the cost effectiveness of hiring more nurses varies significantly depending on hospital size, patient population, and available resources. So some administrators worry that large staffing expansions could cause financial instability. Opposing views also point out that nursing shortages are not equal everywhere. Some regions face extreme shortages while others maintain stable staffing. These fluctuations can depend on local demographics, retirement trends, and workforce patterns. This is why some policymakers see the shortage as a localized rather than national crisis. Despite these concerns, research shows that the shortage is a very real threat. The Gale Encyclopedia of Nursing reports that staffing shortages increase medical errors, prolong hospital stays, and worsen patient outcomes. In the long run, this harms both the healthcare system and the economy because preventable complications increase costs. Major burnout and fatigue. Burnout is one of the biggest drivers of this shortage. Nurses often face emotional exhaustion, trauma, and high patient loads, creating conditions that are simply unsustainable. Yarbrough et al. Describe burnout as an occupational hazard that directly reduces retention. And when nurses leave, the cycle of understaffing only gets worse. Another core cause is education capacity. Even though thousands of people apply to nursing programs like UW and Bellevue College, each year many are turned away because schools don't have enough faculty. Chapin, Paljevic, and Cronin report a 7.9% national nursing faculty vacancy rate, with over half of nursing schools lacking full-time educators without enough faculty. We cannot train enough new nurses to replace retirees. This issue is not limited to the US. Mark and colleagues show that nursing shortages are rising worldwide due to aging populations, chronic illness, and difficulty retaining healthcare workers. Their research emphasizes that the shortage will escalate unless countries invest in workforce retention, expanding education, and improving working conditions. Long-term cost risk. Failing to solve the shortage will actually cost hospitals more in the long run. The Gale Encyclopedia reports that understaffing increases complications and readmissions, which result in financial penalties and higher long-term expenses. So even though hiring more nurses costs money, not doing so can be even more expensive. And common goals. Even though both sides disagree on the severity of the shortage, they share important goals: safe staffing, financial sustainability, and strong nursing education. Both acknowledge that faculty shortages limit program capacity, and both agree that coordinated planning, not quick fixes, is necessary. One balanced solution is phase staffing. Um, Instead of hiring large numbers of nurses all at once, hospitals can gradually adjust staffing based on patient acuity and financial capacity. Griffiths et al. Found that targeted ratios in higher risk units produced the greatest benefits while minimizing costs. Strengthening education. Another major middle ground solution: expanding nursing faculty. Investing in nurse educators has a multiplier effect because one educator trains dozens of nurses every year. Since both sides agree education must improve, this becomes a very strong, realistic shared solution. Mental health support. Improving nurse mental health is also critical. Research recommends resilience training, mentorship, and structured emotional support programs. Hospitals without these supports face much higher turnover rates. So improving mental health not also protects nurses but also saves money. Incentive programs. Hospitals and policymakers can also use incentives to reward safe staffing and workforce investments. Loan forgiveness, retention bonuses, and state or federal funding can encourage hospitals to prioritize nurses while staying financially stable. Incentives help bridge the gap between economic concerns and patient safety goals as well. Um, And then, in conclusion, why this topic matters? Well, nurses are the backbone of the healthcare system. They provide hands on care, monitor patient conditions, coordinate treatments, and support families. When nurses are overwhelmed or understaffed, the entire system becomes unstable. A shortage of nurses ultimately means a shortage of safe and effective healthcare. To address the shortage, we need to expand faculty and clinical training spots, enforce safe staffing ratios, reduce workload stress, and support mental health. We also need policies that reward hospitals for maintaining safe staffing and that values nurses' expertise by including them in decision making. This topic is personal to me because during my CNA training, I saw firsthand how deeply short staffing affects nurses. I saw nurses skipping breaks, staying late, and pushing through exhaustion just to keep patients safe. That experience made me realize how urgent this issue is, not just for nurses, but for everyone who depends on their healthcare. I want to enter a professional where nurses are supported, valued, and protected, and that's why addressing this crisis matters. Here are my references, and thank you for listening.